So I'm appropriately embarrassed. Kelly, I want to thank you so much. What a great honor. You know, I couldn't even begin to start this conversation without recognizing Dr. Gavin. So when I was a pup, and I'm sort of a, and I was a pup, he was there helping us, particularly in the space of diabetes and understanding. So I want to give a great shout out to him and thank him for all that he helped us do. So I don't want to talk about myself. I want to talk about you, really. And I want to talk about our future. And I want to start off by telling you how we think about things and how we might collaborate. So we are in the 21st century. And for those who don't know, my doctorate is in history, and I don't even masquerade as a physician, so Dr. Gavin has trained me carefully about making sure I stay in my lane. But the point is this. Unlike other generations in the past, we're at a place where we can control health outcomes. So what does he actually mean when he says control health outcomes? I mean control health outcomes. If we exit the 21st century and we have not controlled diabetes, we failed. Absolutely and fundamentally, we failed. When I started wandering into this space, back in 1998, we started collecting health data by zip code. And what brought us there was there are roughly 38,000 zip codes in the United States where people live. 70% of African Americans live in 2,500 zip codes. So if you're talking health disparities for African Americans, you're talking 2,500 zip codes. 70% of Hispanics live in 2,500 zip codes, and 50% of Asians live in 1,500 zip codes. So there are roughly 7,000, 8,000 zip codes in the United States where disparities reside. And so we decided that we wanted to collect the data not just in those minority zip codes, but for the whole country. In part because we wanted a comparator, but we decided to set that out. And this is before anybody was talking about big data and analytics and AI and all that stuff. And so we set out to do that. And we've been collecting data for 20 years, and now we have 5 billion patient records. We collect data on 100 million lives a year across 72,000 conditions, and one of them happens to be diabetes. And one of the things I've learned in going through all of that data for 20 years is that there is no such thing as a random cardiovascular event. There is no such thing as a random case of diabetes. These are all highly predictive events. And that's the reason why Aetna and United Healthcare can build systems because they understand the risk down at the community level. The problem is that we don't take that data and use it at the community level to conserve life. So I'm going to give you my point of departure from the historian's perspective and then end quickly where we are right now. I start the conversation with you with the Declaration of Independence. What an odd thing to say at this moment. But here's the point. When the Declaration of Independence was written, the first draft was written by Thomas Jefferson. And he said the reason why we organized government was to preserve life, liberty, and the pursuit of happiness. But the first line was the preservation of life. The prime directive of our social system is to conserve life. You wouldn't know that from all the noise and conversation that we have today. And we accept that as our mission, to contribute and take that on. And so in aggregating those 5 billion patient records, we're not doing that just for the sake of collecting data. We're doing it because we know that these events are highly predictive and we have the capacity to control them. It is our legacy to the future is to control these events. Recently, I've wandered into the space of looking at life expectancy down at the census tract level. And what I found was we have census tracts around the country where life expectancy from birth is 59 years old. 59 years old, and we're in the middle of the 21st century. That is an abomination. We have to accept, not moral, we have to accept fundamental responsibility for that because our mission by our founding fathers is to preserve life. So what we did was we began to aggregate that data by congressional and state legislative districts because we thought members of Congress ought to know fundamentally what is happening to the constituents that you are responsible for. Fundamentally, you have to understand that. And so what I've enjoyed today and learned, because I'm always learning, because I'm meandering in spaces where I don't even belong, but I find so much interest in, is that habit. We can learn habit. And the thing I took away from the meeting this afternoon was you can form habits with people who want to go in that direction. Habits with people who want to go in that direction. So the point is, as you're thinking about your elected officials, as you're thinking about how you organize yourself in the future, and one of the things that excites me about Kelly Crouse and the group that she's organizing, we don't have to teach them that. They want to go there. They're trying to build that. And it is that deep collaboration that opens the door for us as we march into the 21st century. And I'll say this in ending, from the historian's mind eye. So my doctorate, I looked at classical medicine. I was into Aristotle and Hippocrates and Galen and bloodletting and leeches and God knows what else they were doing to each other, right? But they were trying. I mean, at the end of the day, they were trying. We know. We actually know, but we've decided to withhold, right? To withhold the treatment and the therapy. And we call it an access problem, right? That's what we're doing. We are recreating the past deliberately because we think it's too expensive, too inconvenient, don't want to pay taxes. And guess what? I don't even care what my neighbor's health care looks like. So the power of the diatribe and what Kelly is doing is taking us into the 21st century, deep into the 21st century, and helping us to lay the foundation so that we have the capacity to actually do something that generations can't or even imagine to do in the past. So I thank you very much for this honor. It is tremendous, and I look forward to working with you.